Have you ever wondered what a Lexiscan nuclear stress test is? Today, we're diving deep into this medical procedure to help demystify what it involves step by step. Firstly, it's important to understand that a Lexiscan nuclear stress test is a type of imaging test that allows doctors to examine the blood flow to your heart. It's especially used when traditional exercise stress tests aren't suitable or possible. The process begins with a small amount of radioactive tracer injected into your body. This might sound a little intimidating, but rest assured it's a safe and common practice in many medical imaging procedures. This tracer allows doctors to see how blood flows to your heart, both at rest and under stress, using a special camera. Before the injection, an intravenous IV line will be inserted into a vein in your arm. This is the pathway through which the radioactive tracer will be introduced. You'll also have electrodes placed on your chest to monitor your heart activity throughout the test. For the stress part of the test, a medication called Lexiscan is injected. This medication mimics the effects of exercise on your heart. It increases blood flow to your heart, simulating what happens when you exercise. After the Lexiscan is injected, another dose of the radioactive tracer is given. The special camera then takes images of your heart. By comparing the images before and after the stress, doctors can identify areas of the heart that may not be receiving enough blood. There are two types of Lexiscan nuclear stress tests, the one-day test and the two-day test. In a one-day test, you'll receive the radioactive tracer twice, once at rest and once after the Lexiscan injection. The whole procedure usually takes about 3 to 4 hours. In a two-day test, the rest and stress parts of the test are performed on different days. This allows for a more detailed comparison of the images and can be useful if doctors need more information about your heart's blood flow. In both types of tests, you'll need to avoid caffeine and certain medications for at least 24 hours before the test. Your doctor will provide a detailed list of what to avoid. To summarize, a Lexiscan nuclear stress test is a diagnostic tool that uses a radioactive tracer and a medication called Lexiscan to examine the blood flow to your heart. It's a safe procedure that can provide essential information about your heart health, especially if traditional exercise stress tests aren't suitable or possible. Whether you're undergoing a one-day or a two-day test, remember to follow your doctor's instructions carefully. This will ensure the most accurate results and a smoother testing experience. And remember, while it might sound a bit daunting, this test is a common, trusted method that helps doctors take the best possible care of your heart.